Yes, so my name's Ramsey Chammaa. I'm a consultant orthopaedic and spinal surgeon. Medicine's been, on a personal level, my grandma went to each of her sons and asked each one in turn to make her a dream come true and do medicine. And each one of them said no in return. So when it came to me and my grandma was sick, I remember as I was towards the end of my schooling career, I wanted to do something, so I could help her understand her condition. And it was something that, I always had a preference towards the sciences. I was always strong in that area. So I think it was for her that I wanted to do that and make her proud, because it was one of her dreams and I wanted to help fulfill that dream. So I did orthopedics quite early on in my training, and I loved the variety such that there isn't just one treatment for every patient, and you have to bespoke the treatment according to the patient's needs, their age, their desires, and their expectations. And I like the fact you have to think out of the box a little bit. I love the fact that I get to treat all age groups. And I have a wide, diverse practice, particularly when it comes to trauma. You don't know what's going to come through the door, so it's quite exhilarating. From a spinal perspective, I picked spinal surgery because, well, it kind of made sense to me, and I like seeing immediate results. So I like not obviously seeing a patient suffering, but coming in with a pain and doing an operation, and immediately that pain goes away. And it's really fulfilling to actually see that patient's journey improve before your eyes. The most rewarding part, I think, would be, as I've alluded to before, it's the fact that I can see patients getting better. So a patient comes in with a slip disc and sciatica, which they've had for years, and it's debilitating and it's very depressing, and it affects their mood and it affects their function. And then I do an operation, and virtually immediately in recovery, the pain is gone and the patient's walking, and you give them their life back and their independence. And I think that's priceless. That's why, we chose to do this profession. And I love the fact that, you can see it immediately. And it's great. I've had patients who say to me, look, I want to do this, but my legs won't carry me. And then I do an operation, and now they're like, you've given me new wheels. I can walk as many miles as you want. And I think there's nothing more rewarding than that. I think they value my transparency, my warm approach, they regularly compliment me on the way that I listen to them. I empathize. I involve them in decision making, and they all say that they like my communication skills. I think it's very easy to get caught up in doctor language, where we keep reeling off words that patients don't understand, but to try and simplify the speech and use different adjuncts like a scan or a model to explain the problem. It's a way of empowering patients, because you educate them and you give them some ownership. And I think that helps them getting better. I think that, I'm lucky I get to treat some of the most remarkable patients. They're all, particularly now during COVID, when everybody's been delayed and managing their conditions at home, you'd expect a lot of them to be quite, not angry, but frustrated, and to take it out on you. But actually, I have some of the loveliest patients who are hardly ever upset, even when their appointment is delayed because of unforeseen circumstances. And I think just it's a tribute to the British public, how tolerating they are. And I think it is a privilege to treat such a society.